Good evening, ladies and gentlemen. This is the North Andover Board of Health meeting for Thursday, February 22nd, 2018. My name is Larry Fixler, and I call the meeting to order. Could we please rise for the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay. I'm going to move right now to our guest speaker under Section 5 of our agenda, and we'll come back to the other areas on the agenda later. I'm very happy to have our guest speaker tonight. It's extremely prevalent, the flu. I've been sick for a few weeks prior to this. I know some other people that are ill. Some have had positive flu streps and so forth, flu cultures and strep throats and so forth. And tonight is extremely apropos. So I'd like to turn the meeting over to Catherine Ellie, our guest speaker. Maybe you could tell us about yourself, your background, where you work, and
Sure. Good evening, and good evening to all the folks in North Andover at home. I'm happy to be here. I'm Catherine Ely. I'm a doctorate-prepared family nurse practitioner, and what that means is that I have advanced degree, I have a doctorate degree to do primary health care. I've been practicing in the Lowell, Greater Lowell area for about 30 years, even though in my heart I still feel 30. I do have many years of experience taking care of patients. I currently work at Circle Health, which is a Lowell General Hospital practice, and it's out of North Andover, and I've been in North Andover for about 3 years. Take care of babies right through to senior citizens at primary care of the Andovers. I'm going to be talking to you tonight about the flu. I have a small slideshow to present, and I think that will start our discussion, and I'm happy to take questions throughout the slideshow.
Can I ask, I get confused, and what's the difference between a nurse practitioner and a physician assistant?
Okay, sure. A nurse practitioner is a nurse. They have anywhere from an associate's degree to a doctorate degree. They're trained in a specialty called nursing. So they have philosophies and theories and science all about nursing. A physician's assistant has training specifically, very specific training, and about 18 months of a training course. They're very specifically trained to assist a physician in a certain area of expertise. Nurse practitioners tend to be more independent. They can own their own practice. They can work independently. We have our own licensure. A physician's assistant works under the licensure of a physician. Okay. Nurse practitioners have their own licensure.
All right, thank you.
You're welcome. Welcome. Yeah, so let's talk a little bit about the flu. Something very prevalent in this community, and actually throughout the whole United States right now. What is the flu? The flu is a contagious respiratory illness. It's a virus. It is something that is passed into the nose, in the throat, and the lungs, and it can cause anywhere from a mild illness to a severe illness. Influenza is a virus. It's not a bacteria, so antibiotics don't work. How do you know if you have the flu? Typically, the flu comes on very sudden. It comes on typically with a fever, chills, aches, sweats, sore throat, muscle aches. I have a chart here that compares the common cold and the flu. Common cold is more gradual. It's more of a slight illness. It's more of a non-achy, non-feverish. The flu is sudden, abrupt, more severe. Typically what I see in the practice is people are presenting with fever and very prevalent sweats. They just sweat at night, sweat during the day, which you don't see that with the common flu. Common cold. I'd like to talk a little bit about how the flu spreads, because I think a lot of people are are not clear on how the flu spreads. It's a virus. So viruses are not living entities. They need a host to survive. So a virus cannot live on this desk unless I immediately coughed on this desk and touched that virus. So a virus is going to die very shortly on inanimate objects. It needs people to be alive. So it's spread from person to person through tiny microdroplets that are spread with a cough or a sneeze or talking. It's spread by a child coughing into their hand and then touching another child, and then that is ingested if they're eating a snack or something, for example. Periods of contagiousness. I wanted to talk about how this can be passed from person to person, and that's really how viruses are spread from person to person. You're mostly contagious the day before you get symptoms, and this is why we have such a large volume of people getting sick, because they don't know they're going to get the flu. So a day before you get sick, you are contagious, and you can be contagious for 5 to 7 days after becoming sick. Flu can cause complications. It typically is not an illness that does cause complications, but we always hear about the worst case scenario. That's what makes the news. The complications can be a pneumonia, ear infection, sinus infection, worsening of a chronic medical condition. So, for example, if you were a heart patient or an asthma patient, or if you had an immune system disease, or if you were a cancer patient, you could get very sick from the flu. People 65 and older are very contagious. Young children, younger than the age of 3, pregnant women, and as I said, these chronic medical conditions put you at high risk for the flu.
Catherine, I have a question for you.
Yes.
When they come into your office and they're seeking help for flu-like symptoms,
Yeah.
and they have a productive cough, and maybe they have excessive dripping in the back of the throat, so everything is going wrong in there, do you normally do a chest x-ray, or do you go by clinical symptoms to diagnose what you think it might be, or how do you determine, besides what you showed us on the chart, do you use any other form of imaging?
Yeah, that's a very good question. I think because a lot of people have the expectation that that's what I'm going to jump to, or that's what healthcare providers are going to jump to. Oh my gosh, let's prove that it's not something very, very serious. They'll need a chest x-ray. Well, I think it's very simple when you're trained in healthcare to use your good clinical judgment. You listen to the patient's history. You then do the clinical exam. You look for your findings. Do they have symptoms of exudate in the back of their throat? That's like patches of white patches. You listen to their lung sounds. Do their lungs sound like good air is being exchanged? There's very typical sounds that you hear if someone has pneumonia. So if you heard that, you would then go on to do the diagnostic. So you use your clinical judgment, your years of experience, and how the patient presents. That's another really key thing that I think is really important to healthcare providers, is when you enter the room to take care of a patient, you look first at what does that patient look like? Are they lying on that bed? It's called toxic looking. They can't lift their head, gray in color. Most patients who have the flu don't look like that. They're still smiling, telling you, I feel miserable, but they're smiling. Or my whole body aches, but they're still sitting there talking animatedly. So these are the kinds of judgments you use as a clinician.
My wife says I look like that most of the time. Oh boy, okay.
Yes. I think the most important thing that I'd like to share with this board and with the audience at home is that get your vaccinations. This is still critically important and still not too late. Vaccination is the way we prevent the flu. There's lots of discussion right now about the vaccinations not working. And flu vaccines are developed by statistics. So they look at last year's flu season, and they look at what is the most prevalent viruses that are out there, and then they make scientific predictions on how to develop these vaccines. The predictions they made this year missed some of the vaccine, the viral, mutations, but it still is effective. Not as effective as typical vaccines are. Typically, flu vaccines are about 55% effective. This year, they're about 35% effective. But it's still better than zero. 35 is better than 0. So get your vaccinations. I can't stress it enough. Also, preventative. And that's another really important point. Prevention is really key. I call this, to the children I take care of, the Batman cape. Cough into the crook of your arm. Cover your hands with a tissue. Good hand washing. 20 seconds of hand washing. I've heard the term, the saying, sing happy birthday while you're washing your hands. Use hand sanitizers. Another very important thing is to stay home. When you get sick, stay home. I can't encourage that enough. And that's what's happening again with the spread of this flu vaccine. People are returning to school and work too soon. You're contagious anywhere from 1 day before before you're ill, and contagious up to 5 to 7 days afterwards. So you need to stay home. Most people don't need to go to the doctor. Flu can be easily managed at home. It's symptomatic care. Take your Tylenol, take your Advil, stay in bed, rest, plenty of hydration, take your naps. Clean and disinfect surfaces that may be contaminated with the flu. But again, viruses don't live long on inanimate objects. If you're walking into a grocery store, yeah, maybe use that little hand wipe that they give you at the market entrance. Carry maybe a little hand sanitizer in your pocket, so when you are going into new environments, you can do that hand sanitizing. This slide is about the disease burden of influenza, and it's presented here to this board and the audience to show you how it's a serious thing. Flu, since 2010, has resulted in many deaths, many cases of illness. The disease burden, meaning how many people are getting sick, is quite high, which creates, of course, doctor's visits, hospitalizations. And again, we're going to next talk about get vaccinated, a little bit more in detail about the flu vaccine. Many people are afraid of the flu vaccine. They're afraid they're going to get the flu from the flu vaccine. The flu vaccine is made from the antigen, and then it is deactivated. So there is no active flu viral contagion in vaccines. It's an inactivated vaccine. You do not get sick from the vaccination. People who shouldn't get the vaccination are just a very few. For example, if you have a very life-threatening reaction to eggs, and that would be anaphylaxis. Your throat would close, you couldn't breathe, you would need an EpiPen. That would be the only type of egg allergy you shouldn't get the flu vaccine. There's also a very rare condition called Guillain-Barré syndrome. It's a temporary paralysis that we don't know what causes it. Some of it's believed from vaccines, some of it's believed from viral. If you've ever had that history, you should not get a flu vaccine.
How young have you inoculated your patients?
You need to get a vaccination at 6 months.
Okay.
And to the rest of your life. Before 6 months, the way that you prevent illness for newborns up to 6 months is the parents need to be vaccinated. Children in the house need to be vaccinated. That's how you can best protect an infant.
Okay, thank you.
You're welcome. Vaccination, we also have to think of vaccination as a public health responsibility. Getting vaccinated means you're protecting your family. Getting vaccinated means you're protecting your community, your schools, your environment. Also protects pregnant women and newborns. Again, it's not too late to get vaccinated. And that's really what I wanted to share with you. That was maybe my closing comment. It's not too late to get vaccinated. And there's still plenty of flu vaccination around in the community. Manufacturers have it. At national, there is no shortage. You can get flu vaccinated.
We still have it
Yes.
available.
Yep.
Yeah, I read thank you very much.
You're welcome.
Thank you.
You're welcome.
I read an interesting article today because I wanted to do more research on the flu and also the diagnosis of the flu as you presented. About a hospital in Rhode Island did a study on how whether they use clinical x-rays or any other type of imaging to determine whether or not you have besides the quick test, whether or not you actually have infiltrates or areas in the lung that might be inflamed or.
Yes, yeah.
And they've found that there's a certain percent of time that the X-ray, which probably is part of a gold standard, was a gold standard, is not the only imaging to use. They found that if people have, like pneumonia, let's say pneumonia develops, and the X-rays won't show a lot of the time if the pneumonia is on the upper part of the lung. So it might miss it. It may miss the infiltrates there. It may show it down in the lower lobes, but not the upper. And for that, they found that a CAT scan, higher form of imaging, showed everything just fine.
Yeah,
And
yeah.
was a better diagnostic tool.
Yes, yes, yes.
So I learned today, what I learned was you can still have influenza or pneumonia with a negative X-ray.
Yes,
I found that
yes.
very interesting.
Yeah, yeah, yeah. I think that's what advances science is when you look at these kinds of comparative studies. But certainly when you bring these kinds of this data evidence to the general population, it has to be rigorously checked for validity. It has to be checked for cost. So to do CAT scans, even though it might be proved to be a better test,
Right.
the number you're going to catch by doing expensive tests like CAT scans is probably not worth that kind of. Yeah.
Nobody's
yeah.
going to pay for it.
Right,
They won't.
exactly.
Unless it's an admittance to the hospital or something like
Exactly,
that.
exactly.
No, that's a good
Exactly.
point.
Catherine, can I ask you a question?
Of course.
And thank you. That was a very nice presentation. Could you just, for the audience, comment on the use of multi-dose vials of flu vaccine and the preservatives that you might need and how those aren't really being used much anymore?
Yeah. What I am aware of with multi-dose vials is they've found that there's some contamination when multi-dose vials are used. People that aren't cleaning off the top, maybe, this is healthcare providers or maybe flu clinics. So they did away with multi-dose vials, is from what I understand.
Yes.
And now every vaccine is a single-dose vial. There is also I believe there is not any more preservative in flu vaccines because of this concern for mercury.
Right,
Right, so
Right, I think
they're
that was-
preservative-free and they're single-use.
right.
So-
people who might not get them because they're worried about
Good point, I'm glad you
preservatives,
brought that up.
really should, that's not really
That is
the
not
current
the
practice.
case, that is not the current
So
practice.
the vaccines that you're getting in 2018 don't contain those preservatives.
Correct, correct.
Thank you.
Correct. You're welcome, you're welcome. Any other questions?
Yeah, Kevin, you had one slide that showed the complications and so on, so maybe kind of expound on that a little bit. So it's
Okay.
really not truly the virus that makes patients sick. I happened to be in the ER at Lowell General last week, and the place is packed, as I'm sure you both know. And you see the doctors and the nurses walking around wearing the masks also, but what is it that really, and there's sort of a lot of talk in the media now about deaths from
Correct.
from flu. Kind of what's
Correct.
the kind of the flow of how somebody
Correct.
gets to that point of
Correct. There are serious complications from the flu. It's rare. The most serious is you're going to get a pneumonia. And basically what happens is consolidation from fluids and exudate build up in the lungs, and then they develop a secondary bacterial infection. People present very, very sick. Their oxygenation rate is low. They feel short of breath. They look sicker. Another complication is a sinus infection. Another complication are ear infections. Sepsis would be the very worst case complication where bacteria gets into your bloodstream. And these are all secondary complications for the flu. Let me follow you. So what happens, what according to the Center for Disease Control, is that we believe that, well, the data is showing that 75% of the people who are going on to these serious complications are unvaccinated. So that is really where we're looking at the deaths that are occurring. These are people that are at higher risk because they're younger, they're higher risk because they're older, or they're not vaccinated. According to the CDC, currently there is 84 pediatric deaths right now that are attributed for this particular flu season, and that's a national number. It is scary. It is scary for every parent to hear that there are deaths, especially in the pediatric population. But when you look at the big, huge population we live in, these are very rare, very unusual events. That's a rare, unusual complication. Again, prevention is vaccination.
So the greatest number of the patients lined up in ER really are not people that are sort of at the store, so
The
to
number
speak,
of people
people
that-
wind up with fever and they just feel very sick and they feel
Fear.
like they...
Fear. The number of people that I'm seeing in my practice, again, where I do family medicine, babies right through to seniors, is fear. Just people are very nervous. They hear of a pediatric death, and they get nervous for the health of their child. It's it's scary to be sick, and I think an event like this hopefully can allay some fears and really encourage people to think of it in a practical manner, that we're all thankfully very healthy and will fare very well if we get this flu. And the other part of flu vaccination, which I didn't mention, is you'll get sick. The symptoms will be milder if you've been vaccinated.
I think every year, the CDC, they sort of do this guesstimate of what the strains will be next year. And,
Yes.
and this is based partly because it takes a long time to develop the flu because of using the egg and the recombinant DNA process. But I think a year or two ago I was starting to read that they're looking at another process to develop vaccines to sort of be a little bit more temporally up to date on what's happening. Do you know anything about that?
I know a little bit about it. There's something called cell-mediated vaccination development, and from my understanding is it's not using an egg protein. It's using, I think it's using, I could be wrong, but I heard insect protein derivatives. I don't know how that all works. I don't know. I'm not an immunologist or a developer for vaccines, but yeah, I've heard there's some different ways that vaccines are developed.
I was reading an article today where you read in the newspaper, like a 12-year-old child will end up dying within a matter of days from pneumonia or caused by the chain of events leading to sepsis, leading to organ failure, and so forth.
Yes.
And people would say, how can a 12-year-old child, and they're so young and healthy, and they have
Yeah.
everything going for them?
Yeah.
And I was kind of I was curious to try to figure out
Yeah.
how something like that could
happen.
blossom.
So again, it's not the flu itself that is killing this child, it's the complications. The viremia causes a decrease in your immune system, and then you're more susceptible to bacteria. There's something called nosocomial infection where you're going to get sicker if you go to the hospital. And that's another kind of thing you need to think about, is you go to the hospital, you're sick already, you're going to be exposed to more sick people. So if it's just fear that's driving you, I would hope that something like this can really allay some of those fears, and stay home and take good care of yourself. You don't need to rush to the doctor. If you have classic flu symptoms, which are basically a big bad cold, you'll do fine at home.
Because a lot of people watching now have those exact same symptoms, and one of our board members wasn't here tonight because we wish him well.
Yeah, it's good that he stayed home so we don't all get sick.
Right. And so people sitting at home are listening and thinking, gee, I have those type of symptoms. What will get me to go to at what point do I say, the heck with this? I'm just going to call to see if I can get into the doctor's office, see somebody, so they can listen to my lung or examine me.
And we would encourage that if you feel that way, for sure. I would say 3 days more of a fever than typical. Typically, we see fever for about 2 days. If it's 3 days, 4 days, come. Shortness of breath, not responding to Tylenol or to ibuprofen for fever reduction. That would be the biggest. Shortness of breath, just really feeling more ill than typical.
With the, just getting back to the children and the inoculations and so forth, I was reading that since they haven't been, let's say a 12-year-old or a 10-year-old, whatever it might be, may not have been receiving inoculations each year and building up the various antibody titers or antiviral titers to the various influenzas. And so when they come in with symptoms like that, and they might test positive. I was reading that when they do get sick, their body's immune system is not as adept because they don't have that buildup of various antibody titers and antiviral titers to protect them. So they get that rush, something called cytokines in the system, which can cause more inflammation and more problems, and they get a massive rush. The body's trying to fight it and fight it and fight it. Yet on the other hand, as you mentioned, the bacterial growth is there, but the body might be concentrating so much
Yeah.
on that viral load
Yeah.
that it can't do both well.
Yeah.
know?
Well, my understanding is that if it's a 12-year-old, for example, your example, and they've never been vaccinated, and I don't think it makes them any more susceptible to serious complications, still get that child vaccinated.
Yeah.
And that vaccination actually has a better chance of working than the child who's gotten vaccinations year after year after year. But again, it's better than vaccinating at any time is better than zero vaccination.
Yeah, I hope people are listening and,
Yeah.
and take heed, because
Yeah.
there are a lot of people that are dying and very sick, very, very sick.
It prevents, mostly I think vaccination too, isn't that so much where our goal is to prevent death? It's to prevent morbidity, which is, I think that's the word I want to use, which is the complications of illness, hospitalizations, medications, the whole burden of illness on our society. So it's not the death specifically, but it's all the other things that come with it. Loss of work, loss of school, you know.
Is there a point where you treat, let's say they do the influenza test, quick test, and they do a strep quick test, and they're both negative.
Yep.
And then a week, 2 weeks later, they still have bad productive cough.
Yep.
Not a whole lot's changed.
Yep.
You go see the doctor,
Yep.
or whomever you see, nurse practitioner, whomever you can get in to see real quick. Is there a point where, and it's a negative test, it may even be a negative x-ray, where you prescribe antibiotics for fear that it could be sinus, or we're at the point where x-rays can be negative?
Yeah.
I don't know what % of the quick tests are negative, but every test has a false positive
Yeah.
attached to it. But is there a point where,
Yeah, that's part of, again, when you go to see a healthcare provider, you're using your best clinical judgments.
Yeah.
And duration of illness is a very significant history that we take, and it does impact our clinical decision-making, absolutely. We'll make decisions based on where we should go. For example, if someone has a cough more than 2 weeks, we might consider doing a chest x-ray. We use that along with listening to our lung sounds. If someone has facial pain and, pain at the back of their neck with some funny frontal headache, we'll use that clinical information to make a decision whether we prescribe an antibiotic for a sinus infection. Yes, duration is very important to clinical decision-making. Yeah.
Can I ask a question about, I think a lot of people wind up going to the doctor because they expect to come out with a prescription for something.
So true.
Or they've heard of Tamiflu and just expect I have a flu. There's got to be something you can prescribe for me to get me better.
Yes, yes.
How often are you actually prescribing something, or should most people expect if they do go to the doctor, they'll leave without a prescription?
Thank you for asking that, because when patients come to us, they want a prescription.
Right.
They want a prescription. They've taken the time, they've paid their copay, they want their prescription. But what we do know is the Tamiflu is an antiviral agent that does not cure you, it just shortens the length of the illness. So instead of being sick for 5 to 7 days, you might be sick for 3 to 7 days. Tamiflu is indicated for people who are younger than age 3 and older than age 65. Typically, for anyone 3 to 64, we don't give Tamiflu if they don't have any other comorbidity, and that means no cardiac disease, no asthma, no cancer, currently radiation therapy that's going on. So typically, no, we don't give medications, we don't give antibiotics, we give supportive care and mostly a good clinical exam, and that's oftentimes very reassuring too. If patients have an exam, have their lungs listened to, they know their lung sounds are clear, they know they're going to be okay, it can go a long way. Reassurance can go a long way.
when you feel sick, you don't want to eat sometimes, you don't want to drink. Can you comment on that aspect of how you can still fight the flu, fight the cold, and
Yeah, hydrate. Isn't there an old saying, feed a cold, starve a fever, starve a fever? I don't know.
Yeah, I know what you mean.
Feed a fever.
Feed a fever, starve a cold?
Is that what it is?
Well,
Starve a cold, feed a fever, I think.
starve a cold, feed a fever. Well, the truth is, don't worry about eating, drink.
That's not liquor, Larry.
Yeah,
Thanks,
even for
Dr.
children, even
McMillan.
for small pediatric patients.
Larry's gonna go home and buy a big gallon of warm whiskey and put it down. He said to drink.
Yes, even for pediatric patients, the important thing is hydration. You can go 24, 48 hours without much nutrition, but as long as you're drinking the Gatorade, little children Pedialyte, hydration is critical. Water, a little more than water if you're going more than 12 hours without having any caloric intake.
It doesn't mean beer. No. You're talking about Gatorade or an electrolyte type product?
Yes,
Yeah. It does
yes,
have electrolytes.
yes.
Oh, you're right. You're right.
Beer?
It does have electrolytes.
Oh, okay.
This is from our doctor.
But I don't recommend it for the flu.
'Cause for a couple years, there's a lot of promise to flu mist because it seems so easy. You know?
Yeah.
We've got a father of some young girls in the back there, and it seemed like a really great way to get kids to the,
No
through
shot.
that vaccination process, and then it went away because it just wasn't that effective. Is that kind of the bottom line of that?
I think they said not to use it for this particular influenza season because it didn't have the proper strains for the viral mutations that were happening for this particular flu
Was
season.
that just this year? It might
Yes.
be able to come back again?
Yes, yes, yes.
Wasn't around last year as well.
Yeah, I remember it's been a,
So like before, so it's 16 into 17 and 17 into 18, so the last 2 years it has not been around.
It's a pretty amazing science, this vaccination development. So they're currently doing, they start in September and they go straight through to January of next year. So they're right now collecting data on developing next season's flu vaccine. And it's worldwide. So they're looking worldwide at viral strains.
I thought I read the flu mist was taken off because they found the efficacy, the absorption just wasn't as effective as getting the injection.
That's what I've read as well.
That's what I thought I read in the pharmacy
Thank you,
journals.
thank you, sure.
So I'm not sure what they'll do moving forward. I don't think it's on the market for this coming fall as well, so.
But that doesn't mean other nasal products. So if you look at like the topical, the steroid type inhalers nasally,
Correct,
they're for
correct.
contact type
Correct.
symptoms in
To
the
the
nose and so
tissues
forth.
itself, right,
Exactly.
right.
Or even naloxone. They make a nasal spray for that. It's so permeable, it goes right in and helps reverse the effect of the
Yes, the
opioids.
opioid
Yeah.
overdose, yeah.
When you get weather like we've had, here I am coughing a little.
I love this question. I'm so glad you asked it.
So, yesterday, I wore a summer shirt. I looked like I was in Hawaii,
Yeah,
and it was 76 degrees.
yeah,
And I took a walk with the wife, and I was sweating. It was warm.
yeah,
And now, when you have a change of fluctuation in temperature of 40 degrees,
yeah.
what does that do to cause you to, like, even I can feel something. Is it the temperature change, the fluctuation that causes the body to respond like this? Or?
I mean, I think we're all sensitive to barometric pressure changes. I mean, even the older we get, if we've ever had a surgery on a joint, I mean, barometric pressure does affect those kinds of things, but people get sick from people, not from the weather.
Okay.
Other people make you sick, not the weather.
All right. Well, that's good. I'm sure people wanted to know that.
It's hard. It's a hard concept to kind of make people believe because it's in many cultures even. Whether I mean, I think there's a lot of European countries. They're always wearing a scarf to protect their neck, to protect their throat, but you get sick from other people, not from the weather.
Well, I used to think that in the middle of winter, when it turns 80, your body's going to start to inflame, swell because of the heat and the humidity. And then a 40-degree drop later, your body has a hard time adapting to it because
Yeah.
it just prepared for summer, and now it's freezing again.
Yeah, yeah.
So I thought changes like that might cause.
Well, I mean, I think that could maybe influence your stamina, but again, it's not going to make you sick because you need a viral or a bacterial antigen or offending agent to
Yeah.
promote an
You
illness.
still need an inoculum,
That's right. Thank you.
exposure of some kind.
Yeah, yeah.
The flu season lasts till, what would you say?
We're supposed to be done by May, but it's year-round. You can get the flu year-round, anytime.
That's what I, okay.
Yeah, but we're right now at the highest. It starts in November, I think, and it peaks until, I think, May.
Okay. But you can still get it in the middle of summer.
Yep, absolutely. You can get the flu year-round.
I don't think people knew that.
Yes, yes, yes.
Okay. Good.
I got a question about the scarf comment you had. You see a lot of people walking around with surgical masks on.
Yes.
What's the effect of that? What's the point of wearing a surgical mask around town?
Well, I don't really know if you're not sick, why you would be doing that, unless you maybe someone who had an immunocompromised immune system.
Okay.
And they don't want to catch a microdroplet of someone passing them by that might be coughing. If you have the flu and you need to get from point A to point B just to get home, you should wear a mask.
Okay. So it's to protect other people from getting sick
To
when you're
protect-
sick.
That's when you should be using a mask.
Yeah.
Just to protect yourself, I don't really think a mask is indicated, again, unless you were immunocompromised.
Okay.
Well, you're right, though. I see in Europe on TV, they wear a lot of masks.
See it everywhere.
Yeah,
All
yeah,
over. I mean,
yeah.
I don't see anybody very rarely wearing a mask here.
I've spent some time in Southeast Asia, and everyone is wearing masks.
You see them at the airport. You see them around town. Yeah. Just curious about it.
Yeah,
That's a good question.
yeah.
Also, always be a surgeon's convention.
Oh, I forgot to take my mask off.
I'd like to ask we have an audience tonight, and I'd like
Is that
to,
what surgeons sound like, right?
Sometimes.
I just wanted to introduce, we have a guest tonight. Our Chairman of the Board of Selectmen, Phil DiCollegiero, is here tonight in the audience. So I wanted to ask, Phil, if you have any questions. You have 3 daughters, you mentioned? Please come on. Join in. It's a discussion.
Want to sit beside me?
No, I did. I thought it was a great presentation. That was very informative, and I just would like to hear more about the town's program, because I didn't even realize that you could still get vaccinated through the town's program, and I feel like I take it for granted. I've used Cheryl Barzak before to stick me, and so I was just curious, actually, because I don't think many people realize that they can go through the town and get their vaccinations, and certainly I didn't think that we could still get vaccinated. So
We still
figure
have,
get up on that soapbox and
there you go.
push the town's program.
So we still do have vaccine available. We pre-order it in the spring for next year. So we order an allotment of doses. We get some from the state and some from a private company. And we use it until it's gone. At the end of the season, before it expires, we can send it back and get credit for next year. But we still do have vaccine available. If anybody needs to get or wants to get vaccinated, please call the health department. We can set up an appointment with our esteemed nurse, and we can get you taken care of.
And typically in the fall, we'll start advertising the flu clinics. So like this past fall, we had a couple of clinics at the senior center. We did a community-wide clinic for ages 3 and older at the high school, and that was, I think, mid-October. And then I held just like a clinic in my office right before Thanksgiving break. So, and then I've tried to like publicize through our town social media just to make people aware, because I actually, before I took this job, didn't really realize that I could get my flu shot. I always got it through work before, so it was something that I didn't realize was so readily available, and I think a lot of people are still kind of in the same position, so we're just been trying to advertise and get the word out more, so more people are aware. No, it's, you just bring your insurance card and fill out an insurance form, and it's all set.
And no copay.
No copay, no, yeah.
Nice.
And even when CVS ran out of their flu shots, they were referring to the health department because they had seen something on one of the Facebook pages, so it's,
Yeah.
we're getting out there, and yeah, hopefully if everyone realizes that, you know, even still, we had some people show up last week still getting flu shots in the, you know, my office, so it's good.
Any pharmacy, too? Any local pharmacy?
Yes,
Yeah.
yeah, of course, no, of course.
You
So,
can get your flu vaccine.
yes, however, some advertise and don't have it. So,
Really?
so yes,
Oh, good to know.
There's
Good to know.
one that still advertises, but yet they haven't had it since November, so.
Really? In North
Yeah.
Andover?
Yeah, so they have been, I don't know if it was power outage related or whatnot, or if they just ran out, but, so they have been great in just saying, okay, the health department has it if people go by looking for it, so.
Okay.
And then,
I just want people to know that, that vaccines don't make money. In fact, vaccines are money losers. So we're offering these things because we care.
Yes.
And, it got so bad in the late 1980s with regard to vaccines that the Department of Health and Human Services had to actually start a national vaccine compensation program because the liability of providing vaccines for the very rare side effects was actually driving vaccine makers out of the market.
Yeah.
So these companies aren't making a killing on these vaccines. It's just they had to have some sort of shielding and a program to compensate the very rare complications from vaccination in order to keep it actually economically viable, which is kind of a scary thing. So had there not been that intervention, we may have had fewer makers of vaccines. Who wants to make something that has a rare side effect and then gets financially destroyed as a result of it? So the town doesn't make money on your vaccine, your local doctor and nurse practitioner doesn't make money on your vaccine. It's just, they offer it because it's effective and because we care.
Yeah, and I really like that comment because, a lot of people, especially in the day and age we live in, the motive for why we're promoting these things can sometimes be suspect. But,
Right.
so it's a really good point in that we are not motivated by a financial desire. It's a concern for public health. It's a concern for the young moms, the young babies, the seniors in our communities. And we all have a responsibility because that's how germs are spread from person to person.
Well, we live in communities and we get
And we live
sick
in
as a
community.
community too. So.
Yeah, and we get sick as a community, yeah.
Just one last thing. Caroline, could you just let everyone know what other vaccines do we offer as part of our town?
right now, just the pneumonia vaccine and the flu vaccine, and we're hoping to start expanding on that. Shingles we do not have right now because they have a new shingles vaccine, so once that starts becoming covered by insurance, we'll start to branch out in that direction. And then we don't do childhood vaccines because we need a certain refrigerator to do that. So
Okay.
that's it for right now.
Catherine,
It's been such a pleasure.
thank you.
You're welcome.
It was delightful.
Oh, it was a pleasure for me, too.
It was so appropriate for tonight,
Great.
and
Great.
it was wonderful. Where is your office again, so that people know?
We are taking new patients, so we'd be happy to have anyone that is in the North Andover area that's looking for primary care join us. We are at 203 Turnpike Street in North Andover, right across from the Burger King, Rocky's Hardware. I think everyone in Andover knows where Rocky's Hardware is.
Okay.
It's where I go on my lunch break.
Well, I want to thank you very much for coming tonight. It was a
welcome.
great presentation,
Oh,
and it
I'm
sparked
glad you liked it.
some very good discussion, and hopefully the audience out there will pick up and learn something, or go see their doctor if they're not feeling well.
Yes,
I mean,
yes,
this is a
yes.
big deal.
Yes. it
So I
is.
hope everyone listening takes heed to what you said.
Yeah.
And
yeah.
I want to thank you.
You're welcome. My pleasure.
Pleasure.
My pleasure. Great.
Thank you.
Good night. Good night.
Okay. Okay, Joe's not here, so we're going to carry the minutes over
Carry the minutes until next month?
till next month, yeah.
What we've done before is we can vote them in, and he can sign it later. He doesn't have to sign it tonight
Okay, thank you.
if you want to get it dispensed with.
Yeah, I think
Okay.
that's reasonable. I'll second Tom's
As we have a
motion.
quorum, we can still approve the minutes.
Okay.
I can't vote because I wasn't here.
You can still vote.
Can I?
Yeah.
Even though I'm not sure if they're correct?
You're here now, you can vote now.
Yeah, but she couldn't before. Remember, once you mentioned
But
to
she
me?
wasn't on the board before.
She was. That time.
No, she was appointed after that meeting.
Oh, was it
She
afterwards?
wasn't officially on the board yet
Okay, fine.
when the
Fine.
meeting took place, but she's on the board for this past meeting.
Okay. I thought you couldn't vote on it unless you participated at the meeting, if you were at the meeting.
You could vote on it if you watched it on TV.
Okay. Sounds good to me.
Great.
We have a motion? We have a second?
Second.
All those in favor?
Aye.
Aye. All those opposed? Unanimous.
Okay,
Okay,
unanimous.
very good. That was a good report. I really enjoyed
It was
talking
very,
about that.
the timing was perfect with all of the media coverage and all of the news about this strain of the flu and the complications and the issues out there in the community. So I think this was great. Hopefully people definitely picked up something from the presentation and learned something.
Yeah. Let's see, no public hearings. Any new business? Nothing under there, but you can go down, skip down to, let's skip down to, new business would be listed on there, but we can still talk about something if you want to bring it up.
Nope, no
Okay.
business, just, I'll have some updates for you later on.
All right, why don't we go the department reports and the septic installation. Just want to do department reports.
Okay.
So how was last month, Brian?
Busy. Busy as usual, but good. So your reports are in your packets from Caroline, Michelle, and me. So it's definitely a busy month, a lot going on. Winters usually, or used to slow down, but they don't slow down anymore for us. We are a year-round department. I did several meetings this month with the Regional 3B Public Health Coalition. One of the things we're working on is a regional emergency dispensing site plan. So if there's ever a need, we can open up a regional versus a local dispensing site for medication or various immunizations. A lot of logistics in that and a lot of sit-down and discussions as to how to get that done. Share resources, share a location, share all of your staff, things like that. So that's in the works right now. We're working on that, and we have some future meetings coming up, trying to isolate a location that's convenient for the northeast, or the northern section of our regional coalition. And I will give you more information as that comes around. We did have a TRC on a new business coming into town called the Wine Lab. We'll be opening up over at the Mills. It's a make-your-own wine location, so that's very interesting. And then I did meet with Merrimack College. We are going to be hopefully getting a fellowship intern next year, a graduate student, to come in, and what I propose with them is a community health assessment. Hospitals do them every year, or every 3 years, for their regional and their catchment areas. I want to narrow it down and have somebody look at the data and analyze it for North Andover only, to help us give us some direction as to some of the areas that we should concentrate on for North Andover. So hopefully we get a really good intern for that, and we get some good information out of it. Trainings, I did a couple trainings this past month, and one of them was on natural gas infrastructure at Boston University School of Public Health.
Oh, you went to that?
I did.
Son of a, I
did.
saw that advertised.
It was
Yeah, I saw
amazing.
that too.
It was amazing.
So what'd you learn?
There are a lot of imminent risks with natural gas.
Right.
Not just from the fracking, but from the actual utility itself, the fixtures, the gas lines in the street. Some of the gas lines in Boston are over 100 years old. There is an estimated at least 5,000 leaks currently in Boston right now, where if you walk around town, you can smell sulfur. There's a group that did an actual study and walked Boston with a photoionization detector and recorded all of their hits and their readings.
Wow.
And they tallied up 5,000 leaks in Boston, some of them greater than others, that are a serious problem. It's all across the country. It's aging infrastructure. There is no real regulatory oversight on these things, unfortunately. They call it the Cheney loophole, where the EPA doesn't have any oversight and the federal government doesn't oversee natural gas infrastructure.
Wow.
So it's pretty scary.
The what, the Cheney loophole?
Yes. The Halliburton loophole, where they can frack and they put all of these chemicals into the ground and you don't know what's in it and they won't tell us. They don't have to, and there's no government body that can mandate what they actually use in those chemicals, but they use benzene, toluene, heavy metals. They use some really, really nasty stuff that proprietary information shields them from declaring what's in it. But out of the declared substances that they have declared on their own include a lot of carcinogens. Benzene is one of the main ones, but there's a lot of them. And it was very enlightening to see this training and to hear what these groups had researched and found out and talked about. They talked about explosions in gas pipes all across the country. It's a fairly common occurrence. Some of them are very, very small. Some of them are extremely big, where there's injuries and deaths and things like that. So, just a very interesting training and getting the public health perspective on natural gas infrastructure, which you don't really think about out here. We don't really have fracking
We
here.
thought about it. We actually dealt with it about 10 years ago.
The
We had
pipeline.
the Maritime and Northeast Pipeline, they wanted to put a
That
compression
was one of the
station.
folders I gave you, Lou.
Yep.
Yeah,
All right.
and it happened to be around the time that the economy tanked, so it ended up not going. But, the Federal Energy Regulatory Commission, the FERC, has basically carte blanche. There's nothing that we can do about it.
Right. So these companies have a lot of power. The EPA doesn't have any oversight over them. So the chemicals that they use, the infrastructure that they put in place, and a lot of it's grandfathered in, so they did make rules back in the 70s. So certain things have to meet criteria from the 70s, and then any additions later on. But anything before that is grandfathered in, which is the oldest stuff out there, but doesn't meet the current regulations, and they can't make them replace it. So hopefully someday they do get some oversight and do get some more regulatory enforcement on how to maintain and how often they have to maintain. So right now there are tests they do, and every 7 years they have to test in certain areas depending on how old the pipe is. And sometimes it's not quite, the intervals are spread out a little bit too far, and things do happen.
Seems like a monstrous job to replace pipe.
Extremely.
I mean, it's just the costs and the time.
Yeah.
Well, it's like fixing our electric grid. I mean, but at least it's above the ground rather than digging in the ground.
Yes, and obviously being underground does cause its own issues with deterioration in the materials that were used a long time ago, notwithstanding basically, Mother Nature. And all the decay of the metals and things that they use underground. So, very interesting stuff. Obviously, we did some inspections this past month. One of the big ones on there is housing inspections. We have been working on our comprehensive inspection teams over at Royalcrest. That's getting everybody out there with health, building, plumbing, electrical, planning, conservation, and going and doing building by building inspections of all the units. So this past month, we did 36 units. We're going to be doing them every week, so another 12 every week, and working on that. So that's a long-going project for probably the next year. But we're going through each apartment and inspecting every unit and citing them for any code violations that they're going to have to fix.
We have 4 abandoned properties in town, is that what it is?
No, I looked at 4 houses that were potentially abandoned.
Okay.
Just through a resident email that sent some pictures of some houses that could go either way.
Okay.
So I went just to check them out. Tony helped me with those as well, getting the property cards and getting the history of certain properties. But there's definitely a few around town. A lot of them are being maintained by the banks. Some of them people actually live in.
Habitable?
Haven't been inside.
Okay.
And so building permit applications and occupancy permits, did about 75. Those things just keep coming in and they don't stop. Which I guess is a good thing for business.
Yeah. They all come with fees, right?
It's good for the town.
Yeah. And Megan submitted 37 food inspection reports that I reviewed. She just submitted them this week. Basic administration of, me and Michelle worked on our housing order letter template and added some new clauses in there about if a housing unit is vacated during the process, they can't re-rent it until all the violations are corrected. So we just added some more teeth to our order letters.
It's a good idea.
And general customer service, animal control, Marie Petto's always around. and some
What-
work on the body art regulations.
What was a trash complaint we had? What was it about?
Trash barrels. There's a housing building that has a bunch of trash barrels out back that
Okay.
aren't maintained.
Oh, all right, okay. I thought it was illegal dumping or something like that.
No, it's
Okay.
trash barrels and rodents and things like that.
Okay.
And worked on the body art regulations and researched information on that. I've been talking about that with Larry. We still haven't sat down to meet yet, but we're going to.
We will.
All right, good. And then general correspondence, septic approvals and denials, garbage disposal letters going out. I did submit to send out a septic installer denial that I copied you guys in your packet. That may come before us if he appeals it next month. But we will wait and see, and I will definitely let you know if he does. Royal Crest did appeal their first order letter from the comprehensive inspection team that went out. I believe that was also in your packets as well. Hopefully going to be working with JRM on their permit application for this trash season. And Wheelabrator, I worked with them and got a sign made. There used to be a sign at the end of Holt Road that had a designated route sign telling the trash trucks leaving where they should go. That, for some reason,
When
went
you were
missing.
going out, right? There was a
Correct.
sign that said turn left only or something?
Yes, yep. So I
That
worked with...
sign disappeared?
Yes. But I drove to the PD, we got an old picture of it. I worked with Wheelabrator, and they got 3 new signs made up. They have them in their office, I just gotta get one, talk to the DPW, they're gonna put it up for us. So I'm gonna get that replaced hopefully this week.
Good.
And correspondence for the chairman on a regular basis, keeping you guys in the loop, always good.
I don't call as much. All right, Caroline.
So my report's not as exciting as Brian's.
I'm
still
sorry,
doing
Brian,
some-
the JRM thing, this is just getting more information from them on
I'm
their,
working with them on
their
getting their
truck.
package and permit issued this time.
just filling in missing stuff and so on.
Correct.
So as I mentioned, I'm still, have a couple of in-office influenza, people coming in for flu shots. Trying to get the word out that we have the pneumonia vaccine. I started doing cholesterol clinics back in the fall, and they kind of tapered off. So I did a clinic today, and I'm going to do another one at the end of March for the seniors. Also rotating the blood pressure clinic through some of the senior developments, which is still catching steam. So I'm just going to have to find different ways to get them out and into the common area for that. A fair amount of unscheduled walk-ins, just, a couple things going on with the senior center and myself and the staff, and just, taking care of some concerns over there with them. What else? Doing the coalition meetings with Brian. I have attended a Massachusetts public health nurse chapter meeting, and at that meeting they had someone come from Reading who had discussed mental health first aid and how they had received a grant a few years ago that had basically funded their whole town in getting trained in mental health first aid training, which I thought was amazing. And so I started kind of looking into that. Right now there aren't any grants that I have found that are available still, because this was back I think in 2014, 2015 that they were available. So I started looking into getting myself trained and possibly starting to kind of branch it out throughout the town. With the library, how we used to do the lecture series, we actually, even before all of that with the meeting, we were looking into mental health being March's topic. So we have been looking for a speaker for that library date, which is March 14th, and I'm pretty sure we have a speaker who is a mental health first aid instructor. So I'm just waiting to kind of confirm that with her, and then hopefully she'll be able to come to the library and speak. What else? A few cluster activities with some of the long-term care facilities, some influenza, some GI illnesses. We had an American Red Cross site visit to the senior center to run a blood drive there. that is scheduled for, they wanted to do a Saturday because they're trying to roll out some Saturday events at the senior center. So the first available Saturday they had was June 30th. So we're trying to get some involvement through the community and try to do like a battle of the badges and have, whether it be the fire department and police department and or other departments throughout the town, just kind of raise awareness and try to get some people to come and donate blood at that blood drive. So,
Caroline, excuse me, what is it, can you just, what's the mental health?
oh yeah.
Can you just tell me what that's about, what it is?
So the mental health first aid, it's to basically raise awareness. So it's kind of like the mindset is what CPR would do for someone who is having a medical emergency. This is a first aid training for someone who is maybe having a mental health, I don't want to say crisis, but maybe recognizing signs and symptoms of someone who's struggling before it gets to the point where it becomes a crisis, and giving them the appropriate resources, knowing how to talk to them, how to recognize things. So it's, it was started actually after the Sandy Hook shooting, and it's kind of been ongoing and something that obviously now, the last few weeks in the news, it's been something that I think is important to have here in the town. So.
Sounds very good program.
Yeah, so.
Thank you.
Yep.
Okay, and then Michelle did her,
She did?
a whole bunch of
Yes.
inspections and trash and permitting and so forth. That probably took a lot of time, so
Definitely.
it is, okay.
I don't know.
Besides the, trash-wise, as far as the permitting, JRM is the only one we're working with now to finish up all the permitting. Are there any other problems, areas out there?
I
No
think there's
problems.
a couple more that we're gonna have to work on
Okay.
after this.
Yeah.
but This was the big one to start off with.
Okay.
With some of you that still have information that they need to give us. So this is, get the big one first and then go down through the, few that are remaining.
Okay.
That was actually taking up a lot of time. But we're almost there.
The septic install, is this, did you want to?
Nope, just wanted to give you guys the letter that I
The
sent.
letter, okay, fine.
Give you guys a heads up that,
Okay.
that's in the works. That may come before you next month.
So he did submit an application since last month, because last month you said he had not.
Correct. Yep, we got it, and then I, in turn, drafted that write-up and sent that, what, 2 days ago? Yeah.
Okay.
Royal Crest did appeal their first order letter for the comprehensive inspection team. Our department ended up getting that out. The building department had some issues on their side, so they couldn't get to the letter in time. We wanted to get it out as soon as possible. So we stepped up, and Michelle and I got the letter out, 2 weeks ago? I think the first week in February. And they did since appeal it, so that will be on your agenda for next meeting. They're gonna come in and appeal.
Right, so ask Tony, so if they're gonna come to us next month, you'll send us a copy of the actual order letter that they're appealing?
Yes. Yep. I think I just gave you guys a copy of the actual appeal letter that I said scheduling the hearing for next month. But that will be emailed to you guys, the whole packet.
All right, and that'll show whatever deficiencies they need to work on.
Yes.
Is that it? Okay.
Yep. That was 3 buildings worth of apartments.
Well, we can discuss that next month when they're in front of us, rather than discuss it now.
Yep.
Okay. Anyone else want to bring anything up? Any business at all? Correspondence?
What is Howling Wolf?
Where's that?
That is gonna be over next to Fuddruckers in that plaza, off of 114.
Okay.
Right across from Chestnut Green. It's an upscale Chipotle. It's gonna have a bar also inside. They are in the construction phases now and should be completed really soon. They're working on getting everything set up, and they should be doing a pre-opening inspection, say, over the next week or 2.
Oh, wonderful.
Yeah, so let's go in and all the ingredients are there. Tell them what you want. You can sit and you can have a drink. They have a few other locations in Massachusetts, so they definitely know what they're doing. So we have high hopes.
Excellent. It's great to see new business,
Yeah.
new restaurants open up in town.
Yes, thank you. I guess just, let me just reiterate how people can get vaccinations or flu shots if they need them.
Sure. So anytime the health department's open, I mean, they can come, they can call me directly, they can email me, however, I mean, I can set up a time, appointment, walk-ins. I'm always open to do, is that what you're talking about, flu
Yeah,
vaccines?
yeah.
Okay, yeah, so I'm always open to have anyone, I've had walk-ins, I've had people call me and set up times, whatever is convenient. My number's 978-688-9543, so they can call me at any time and set something up. I have plenty of vaccine left over, so.
Awesome.
And since you said you have pneumonia vaccine available, what are the criteria for getting the pneumonia vaccine?
So it
Because I think I'm close.
So it depends, so anyone over 65 should have Prevnar 13 and then a
Not
year.
that close.
Anyone over 65 should have Prevnar 13 and then a year later, the Pneumovax 23.
PSV 23.
Yes, thank you. So, and then depending on, some people have already received a vaccine before they're 65, so then that kind of changes what they should be getting after 65. So if they have a a chronic condition that would qualify them to get a vaccine before 65, then after 65, as long as they've had both of them. So there's a lot of different criteria, but typically anyone 65 and older should have each Prevnar 13 and Pneumovax 23.
But people
A year
younger than
apart.
65, if you're immune suppressed, like you have
Right.
rheumatoid arthritis,
Right.
colitis, or Crohn's, you're
Lupus,
on
There's different.
you're on an immunosuppressant. If you're on prednisone, that's a good reason. So if you're an asthmatic who's
Right,
dependent
some
on
people get-
prednisone, or you're a diabetic,
Right.
that's another reason.
Exactly.
So that is,
So depending
people
on
don't
what-
think of themselves as being immune suppressed, but if you're an asthmatic and you're taking steroids, you're immune suppressed.
Right.
Interesting.
So I have both of those. Prevnar 13 and Pneumovax.
Awesome.
I do want to make an announcement for all those watching. Hopefully there are thousands out there. Our own in-house doctor, Dr. Frank McMillan, is going to be giving a talk next month on the topic of addiction. And I'm looking forward to it very much because it's as prevalent as the flu is today. So Frank will be doing a presentation on that. March 22nd is our meeting? Is that what it is?
All right.
So I want to let everyone know that, and I think that'll generate a lot of very good discussion.
We'll get our flyer going.
Definitely.
Anyone have anything else?
10 minutes. It'll be 10 minutes.
Go longer. How can you
You don't
do
want a flyer?
addiction in 10 minutes?
It can be done.
It doesn't have to, it can be addiction with, what, opioids? It can be addiction in...
It's going to be just general principles and scientific principles that we can use to apply to new situations.
I'll probably expand and talk about cognitive behavior therapy and all that obsessive compulsive disorders.
Not going to
I
get
love
into
talking about
therapies. I'm
that.
going to get into general principles.
all right.
So I can do it in 10 minutes.
Okay.
I think, as we're speaking about addiction, just from a public announcement, I don't know if it's been found more in this area, but they're finding a lot more fentanyl in cocaine, and just getting that word out is really important. I think people are expecting that fentanyl's out there in heroin, but I just think a public announcement that people know that they're finding more and more fentanyl in cocaine right now.
So you guys seeing an increase in hospitalizations?
I'm hearing it, actually, I got to participate in a presentation by the DEA a couple weeks ago, and their forecast is that the opioid crisis is shortly going to become a cocaine crisis, and that there's a lot of overproduction of cocaine, that prices are coming way down, and because it's less about heroin on the street now and more fentanyl, fentanyl also can get into cocaine fairly easily, but I think people aren't equipping themselves with Narcan, people who use cocaine are not necessarily thinking about something like Narcan.
Right.
Where I think we've done a good job as a society getting people to have Narcan for heroin. So it's just something I think people should know that it's out there.
Interesting.
Yeah, it's very interesting.
You must say, you work at Lowell General, so your emergency room must have a lot of
Overdoses.
overdoses come in. I don't know how many emergency room visits per year or what percent of the admission, of the emergency room visits would be overdoses, but it must be significant.
More and more.
It's a lot. I was in the ER a lot over this past weekend, and I started talking to different people, and there were apparently 20 reported overdoses in Lowell over the weekend
Wow.
Yeah,
that were treated successfully by the police or first responders.
correct.
So there's now a protocol in place in that region that they track it, and if it gets to a certain amount, there's a public communication plan that goes out. I'm actually one of the people who gets notified, and it's our job to just spread it out, and you tell people, not to use alone. I was actually at a meeting today where the chief of police said, right now, they're able to revive about 100% of people who overdose in the presence of someone else. Most of the fatalities at this point are people who are using alone
Nobody said to call 911 on them, for them.
or use Narcan.
Or use Narcan, yeah.
Yeah.
Okay.
It's for the opioids and so forth, but for cocaine, there's no reversal agent that I know of unless, it's more, I thought supportive care, unless, maybe it's just not, I missed it.
No, I think the point is that the fentanyl is
Yeah.
adulterating, the cocaine is being adulterated
With
with the
fentanyl.
fentanyl. So
So instead
you're
of
getting an opioid
overdose.
overdose without knowing that you're even at risk for it.
All
Right.
Dangerous. Wow.
Unbelievable.
Scary.
Well, anyone have anything else?
That's an amazing story.
I did reach out to Ron. I think you guys had emailed
Yeah.
back and forth. He is available for the March meeting and the April meeting. I didn't know which one you wanted to do.
I'll give him a
vaping.
call and kind of fill him in.
Okay. So is it going to be him on the 22nd as well?
Yeah, I'd like to have him there, because I want to
Okay.
ask him some questions.
Okay,
He's always
perfect.
been very good to us, so.
Yes. No, he's great to work with.
Let me just throw this out. If, on the 22nd, we might have we may have two
Public hearings.
public hearings.
Correct.
Right? That's okay, just be a longer meeting. We can either do Ron in April or March, doesn't matter to me, whatever you guys want.
If you want to do it in April and schedule the discussion for April and do public hearings next month, or play it by ear for now and see if we even have that second public hearing. If it's only one, then that's not a big deal.
Maybe we should do it while school's still in session.
Maybe we'll just
Okay.
make a decision based on what the needs are.
Okay. But Ron is available for both meetings, so I just want to throw that out there.
Okay.
So yeah, so you guys debate it, think of what you want to do, tell me which meeting you want to have it on. It should be a longer meeting in March and less in April.
What do you think, Frank? Do you want to have Ron, and does it matter if we have him in March or April, or you want to?
I'd prefer to have him in March.
Then let's,
I think it's one of those
I
issues
think
that's
I
been around
suggested
for
in
a
April, I
while.
could talk, I can give a 10-minute presentation. April happens to be both sort of facial protection, trauma month, and head and neck cancer. So I could do a quickie on either one of those at that point if you're going to do something next month.
Yeah, I think the vaping's been around, we've been discussing it for a while, so it is more, I think a little more pressing to do it in March.
Yeah, and there's just new stuff about it. I mean, the most recent thing I saw was there's this thing called popcorn lung. Popcorn lung comes from the food additive called diacetyl.
Yes.
That if you inhale it, the people who are in the factory that manufactures it, apparently it's toxic to your lungs.
oh,
And it's a flavoring that's used in the vaping products. So
Yep.
it's a little more evidence that stuff might be not as safe as we think it is.
Yeah, and I read about popcorn lung, I think, last year, so it's been starting to come around, and
Yeah.
it's getting probably more prevalent now with the
Yeah.
increase in use. Seen a couple of very interesting things on vaping. One of the articles that I have that I was going to send out to you guys before the next meeting was, it's called Juul.
Yes.
Oh,
All over the high school, sorry.
and they're disguised as thumb drives.
Yes.
Unbelievable. So you can stick it in your laptop to charge it up, or your tablet. It looks like a thumb drive, and you can smoke in the hallway.
They're smoking in class.
There you go. So
Doesn't it have smoke to it or anything, the vaping?
vapor, but it's just vapor.
It's
So
just
you
vapor.
can probably hide that a lot easier than an actual lit cigarette.
Oh, wow. Okay.
So, yeah, I printed it out, I have it on my desk. I was gonna scan it and email it to you guys. Yeah, and you can buy covers for them, so they have like smiley faces on them, and, yeah, it's called jewel skin or something, yeah.
Oh, boy. All right, so we'll do it. So Frank will talk about addiction in March. We'll have Ron Beauregard here, and we'll talk about tobacco and vaping in
Yep.
March. And then Dr. Trowbridge will talk about oral cancer and
Well, I'll just do one or the other. I
It's
don't
up
have
to
any
you.
sort of, see what resource I have that's better. at the
yeah,
time.
whatever you, just let Brian know, and we'll get it out there on the web. You'll be all over the web.
Beautiful.
Well, if there's nothing else,
Move to adjourn.
move to adjourn. Frank, move to adjourn.
Second.
All those in favor, say aye.
Aye.
Aye. We're adjourned.
Done.